hour and a half, 2 hours in the OR, okay? The rib stuff is about an hour, so altogether it's probably about 3 hours-ish in the OR, okay? It's general anesthesia, so you're completely asleep for it, and it's outpatient surgery, so you can go home the same day, you don't need to be admitted to a hospital or anything like that, okay? There are no drains when it comes to the reverse tummy tuck,
okay,
which is nice.
That's nice.
Everyone loves that,
Yeah.
awesome. Let's talk about rib stuff. Because most of your recovery is probably going to be kind of rib stuff, right? So when it comes to the rib remodeling, we have to do a corset, and we have to do that for about 3 months afterwards, all right? Day and night. You got to wear it all the time,
right?
And it's not like a full faja, it's more of a corset, right?
Okay.
Really just kind of from here to here, right? Like a waist trainer.
Right. Okay, so it's like a waist trainer.
It's like a waist trainer, exactly.
Okay.
Corset / waist trainer, kind of the same thing, right?
Okay.
And so what you're going to do is, after surgery, you're going to go about 1 centimeter per day that you're going to reduce that waist. Okay. So the first day you're going to go 1 centimeter, the next day you can go 2 centimeters. So after 10 days, you've kind of slowly reduced that waist by 4 inches, right?
Okay.
Or you go to about where you like it. Because like you may decide you like 3 inches. You may not want 4, right? Because everybody wants more, but you basically choose where you want, and then you go a little bit tighter with it, okay?
Okay.
The corset is really like the most important part. Your part is probably more important than the surgery part, because if you don't wear it all the time, the ribs are just going to kind of pop back to where they were, right? So you're able to basically hold them into the right place until they remodel into that, and they heal up in that new place, and then you're good, okay? Things like the rare complications that can happen, pneumothorax is where like you can get an injury to kind of like the lung, and you might need a little tube to kind of help get some of that air out of the lung. That's a very low chance, like less than 1%, okay? We do this with ultrasound, so we can try to prevent that basically, right? Can you have some pain that goes on for like longer? You can, some people do, it's a very small percentage. Usually that comes down to if the bones have not healed right, which means that like you gotta make sure that you're wearing the corset all the time. Also helps when you're under like 45 years old, because you don't have osteoporosis and your bones will heal properly. Those are kind of like the biggest things that we deal with, right? As far as restrictions, taking time off work, all that kind of stuff, right? You don't want to work out for about 8 weeks out. 8 weeks, okay? It's not so much a weightlifting restriction. You just don't want to lift heavy weights, okay? You don't want to do a lot of side to side motion, because you do this, you're going to be kind of cricking those ribs back and forth and stuff, And then the strenuous activity, about 3 weeks on it, right? So someone like you, massages. I specifically asked this question when I was at the training course and stuff. The person who does this thing, who was doing the training and who does like a ton of these, basically invented the technique. His wife is a massage therapist, and he's like, my wife did it. He's like, 2 to 3 weeks, she was back to work. He's like, but remember with lymphatic massage, you got to do light massage when you're getting back to it, right? Because remember, we know this. Like, if you go heavy with the massage, it's going to close the lymph channels. They don't work as good, right? So for you, 2 to 3 weeks is probably going to be ideal for you to take off of work and stuff, and then get back to it. All right. That's a little bit of everything. Usually I see everybody around like week 1 month, kind of 3 months and 6 months. So we're going to be seeing you at regular intervals, but you'll be letting me know kind of weekly how that waist is doing and how it's holding and all that stuff. We don't need to track the reverse tummy tuck as much past the first couple weeks to make sure you're doing okay, no wounds. The rib remodeling, we want to track it kind of more consistently over the first few months, just to make sure that things are going good, your pain is going down, things are healing. And here's the thing, a certain amount of people barely have any pain with the wrists, by the way.
Woo!
Which is good.
All right, okay.
But it's just like lipo, right? You never know who's going to be who, right? Some people, it's a little harder on them, some people it's a little lighter on them. You've probably had some surgeries that are even harder than this one, so. Compression is important because swelling, we still deal with swelling, okay? Now compression, as we know, is super important with rib remodeling, but it's also important with like the reverse tummy tuck too, okay? So, we always tell people that it can take about 6 months for us to see our final results when it comes to swelling, but around 1 month is when we're starting to look better than starting. But you've probably seen some of the stuff that when we raise that upper abdomen skin, it looks better already. So even at 1 week, even though there's some bunching up the incision underneath the breast, and we have to bunch it up because we're trying to make a shorter incision. We can make it longer and not bunch it up, but we're trying to keep it short, right? So we don't have visibility here, right? So it's going to look better even probably that first week or so, okay? But then as that incision kind of smooths out and things get better, it's going to look even better, okay? Things like infection, bleeding, infection or hematoma, only about a 1% chance, and not too often that we deal with that. I give you antibiotics for weeks, decrease the chance of infection as much as possible, okay? For the upper abdomen, skin excision or reverse tummy tuck, usually I'll have you wearing compression or a faja all the time, day and night for the first month, and then you do half days on month 2, month 3.